All righty. I want to welcome tonight our special guest that's running for the governor of the state of Oklahoma. It's Billy J. Wagner. It's my special guest. I'm going to flip here. I'm going to be asking him a few questions. I'm going to have Billy tell us a little bit about himself and why he's running. And then we'll go right into our AQ, question and answering time. So here you have it. All right, Billy, you are now live on Tell the Truth Tuesday.
Thanks for having
Facebook page broadcast, and you're welcome. Billy, can you please let everybody know your name, where you're from, and what position you're running for?
Mm-hmm. You betcha. My name is Billy Wagner. I'm born and bred in Oklahoma. I'm running for governor of Oklahoma. I've spent the last 25 years looking at the internal clogs of how that system works and how it's ran. Yeah.
Well, there you have it. We're going to ask some questions, Billy,
Yes.
about why you're running for governor of our great state of Oklahoma. And question number one, for people who may not know you yet, who are you and what do you do?
Well, I've done several things. First and foremost, I'm a working guy. I get checks like everybody else, and I see that 50% of that goes to places I don't know, and that's what one of the main reasons why I am running is that the government boils down to systems, and for Oklahoma, I don't think that there is enough oversight. So I've spent the majority of my career building these systems. I did quite a stint in the federal government. I did a stint at NASA, American Airlines, and then for the last 8 years, I've been involved in the state's business. And there are many opportunities to improve.
Okay.
I'm a worker. I'm a construction. I own businesses, fencing company, and so I've hired and I've fired folks. I've given them opportunities. I've given, so I know how that works as well. The small business is very, very important to me, especially the producers that are here in Oklahoma. State of Oklahoma will be open to business for those folks that produce here in Oklahoma, not the data centers that are just going to take your money and give it to another state. The longevity of being profitable is only in the construction phase. So we're going to do something a little different. We're going to make the state of Oklahoma a producer of the support for high-tech chips. Not necessarily manufacturing the chips, but a support thereof. Because the fact is that AI, I'm sorry, I'm expounding on this question here.
That's okay.
But I really want to get to the point that AI is coming.
Okay.
And we have to be prepared for those things because it is going to change how we work. It's going to change how we do things, hopefully for the better. And we have to put guardrails on that so that we don't get left holding the bag, maybe not knowing, what to do. So we want to be support for those, maybe even robotics. This is just,
okay.
That's something that we can do and also provide thousands of jobs for Oklahoma people. As these, we've always had these, we have the industry, things that replace other things, the horse replace, or the car replaced the horse, and so on and so forth. So I'm going to do my very best to keep the Oklahoma people first. And then that's really what this is about, is we're going to take care of our people. Because it doesn't look like people are really listening, at least the higher ups of the administration. They are. So you get a hot nerve there. They're not listening to you, folks, and I want to listen to you, and that's why I've made myself available. at any time, whether I'm elected or I'm not.
Okay.
We need good men to step up. We need good men to talk and say when things aren't right. And it's scary, and it is, it really tests your will. But I think that there are good men, good women out here that want to stand up and fight, not only for the protection of our children, but for education and to move this state forward, to be the example. That's really what I want, is I want Oklahoma to be the example. But we can't get there if we keep doing the same things that we've been doing for years and decades. And that's something you're going to have to decide, is how are you going to vote this year? And hopefully, hopefully I've done enough work. See, I'm not sitting on my butt.
Okay.
I'm not going out there and I'm working. I visit courtrooms where DHS, this might get a little hot, where families are being ripped apart.
Okay.
With what I can see, well, from my own eyes, so that there's no problem there, that there's little to no evidence of things going on, but they can still separate the family. So there was there was constituents at some of the other meetings that had turned me on to that. Mm-hmm. And I grew up in that system. I didn't come with a mother or a father. Okay. I was taken when I was 3. So I know firsthand how good and bad that those systems are. Okay. I didn't have really parental guidance until I was about 12 or 13. Okay. And he put those people in there to teach me from right and wrong. So yeah. Okay.
So I got a question from, where is he from and what type of work do he do?
So I'm from Oklahoma, born in Lawton. I'm Comanche. I'm a construction business, but I'm also a senior architect. So when companies come, maybe they're having trouble, or maybe that their bottom line, or they need some automation. Mm-hmm. So I bring them out of the dark. Okay. So their legacy systems and things like that. So I build software. I build company systems. And that's mainly what I've worked on. Things that I'm trying to figure out an example. Well, I can't use it, but I build software that does things that puts guardrails in place. Okay. So my thought process as far as Oklahoma is, you have to think of it, the system. This all comes down to systems. We don't even need to fight about the parties. That's what I'm saying, because I'm not asking permission from anybody once I get in there. It's day one. This is my job. This is what I do. That's why I put out to see the insurance commissioner, day one, because that's my promise. I'm gonna go see why our insurance is so high, what's going on with that. I worked in insurance for 4 or 5 years. Mm-hmm. When I was younger, so I understand policies and those sort of things. But our property taxes, that's mm-hmm. a big problem. And I tried to figure out how I was going to say this, but I thought when 10 years ago, 15 years ago, we had the casinos. That was supposed to fund education. Then we had the T-set money, cigarette tax. That was supposed to fund education. And then now we have property tax, which a lot of the cities here in Oklahoma, that's another revenue stream. Mm-hmm. But when they can take your home that you bought and you paid for, that's where we can't have that. Right. Because we're fighting that right now. I do real estate as well. I flip homes. I love that. Mm-hmm. And I think it's a good American business to do. I think it's something good to do for your community. Mm-hmm. Is to flip a couple homes and be that entrepreneur that is always striving to be better. But property taxes is a problem. So we have to find out where the money's going. And I get asked that more times. Where's the money going? And 25 years, I still don't know.
Okay.
I still don't know.
Still don't know where the money's going.
I still don't know where it's going. And I can see those things, and we still don't know where it's going. I have to be light on what I say on that, but you have to think of how we're going to do this as an hourglass. You have sand coming in the top, you've got all your content, and then you have the middle part. That's your oversight. Okay. That's your oversight. So everything funnels through this funnel, and that's where we catch fraud, waste, and abuse. So I'm not going to have to be, they're going to want, there's a few other points there, but they're going to want to reduce that. And I don't even, like I said, I don't even have to be the bad guy. They're going to want to do that because things are based upon, the budget for Oklahoma. Now, we do set a budget yearly, but doesn't look like we follow it much. So we're gonna draw that back, and we're gonna get the budget to a stable level.
All right.
I'll probably answer that 3 times more.
That's okay. Good
Kind of
answer.
long-winded. I got a lot to say. I just,
That's all right. We're here to listen tonight.
Yes.
Question number 2. What perspective do you have that most people don't?
This can all be fixed. This can all be fixed. You don't have to worry. You have to worry if you elect the wrong person.
You're talking about the different systems, correct?
I'm talking about the different systems. It all funnels down to systems. Nobody's going to get paid if the system is broke.
Okay.
So we're going to fix that. Or when I say we're. And see, and here's the other end of this, is I have hands-on. I don't, again, the reason why I say I don't have to have permission is because I know what I'm looking at.
Right.
I don't need somebody. I don't need an administration. I don't need an agency to tell me what's going on. I can dive into that myself.
Okay.
But the team is very, very important. And there is another caveat to that, is that when I do, we need a full stop. We need a full stop. That way we can, just like any business, any CEO would do. This is executive level. What's my company doing? Where's my revenue? It's the same way.
Where's the expenses, revenues, to get to the bottom line?
Exactly. So we're going to let the people know that, and we're not going to hide.
So are you going to say you're going to be able to balance the budget in the state of Oklahoma?
We are going to be able to stabilize the budget, and the people will know exactly what we spend their tax dollars on, because it's not our money. It's real easy to spend somebody else's money.
Okay. So
we're not doing that. So we're transparency dashboards, just like the one I'm okay. So this is a little bit on the side. So I'm building something called Axis, and Axis will encompass all the state's business.
Okay.
Everything goes through there. That way, everything can be tracked. Everything can be put into the dashboard. You're going to see what I see, and we haven't had transparency like this. And I don't think the 44 years I've been alive in, but I'm going to do it because that's the problem. Is we don't have any eyes on what they're spending our money on. They can just take our money, they can take our taxes, and they can do it legally.
Right.
So at least at the very end, or at the very end of the point is that we'll be able to see where it goes. And if your eyes are on it, and your neighbor's eyes are on it, it's going to be a lot harder to produce fraud.
Right.
It's going to be a lot harder to do abuse, because you can see the same thing. And for those people that think I won't do that, I will do that. I don't need permission to do it.
Right.
All I've got to do is get there.
Good question. Number 3, why focus on systems instead of people?
Well, people come and go. So I said this to somebody the other day. So people come and go, but systems are concrete. Once those systems are in place, that next person, like I've been telling everybody else, I'm a public servant. When I get done with the 8-year or 4-year, because it's going to take more than 4 years to get this all fixed. But given that if they keep at the end of the 4 years, we're going to do a lot of things, and most of that's on my website. I'm trying to give them as much data or as much as I can tell them about what I'm going to do when I'm in office. I've always been a man of my word. You could probably ask anybody. I do what I say, and I think that's important. But
when you say website, Now, if you guys want to go to the website, it's BillyJWagner.com. BillyJWagner.com, and you'll be able to go to his website to see more. So I just wanted to come in there and let you know about his website.
Yeah. Well, one more point about the people. So
Yes.
people move out, but the systems stay there. So if we tailor that system where the next governor or the next person that gets in here, they can't screw it up as bad.
Okay.
Because there are already guardrails in place. So what happens is that we reduce the government to what we need. So
Okay.
we have a big payroll.
Okay.
And not to say that we're going to just end jobs. We're going to give those people, we're going to find other places for those. And I got a great place for them to go.
Okay.
But we're going to reduce the administration that way. There's one point of accountability.
Accountability, okay.
Yes, ma'am.
Well, accountability is very important to us all. We should be good stewards of the taxpayers' dollars.
That's what the Bible teaches us.
Yes. Question 4. What changes when systems are clear and more transparent?
Well, oftentimes I say when government runs smoothly, you won't even know it's there.
Okay.
So right now it's not running good. In fact, it's terrible.
Okay.
So you're hearing a lot more about it. When I was a kid, you barely heard, about the government doing this and doing that.
Right.
We were able to go, Friday night dinners with the family. We were able to go on vacations and those sort of things. Yeah.
Okay.
Yeah, that's my answer.
What do you want Oklahomans to look like if systems run better?
I want Oklahoma to be self-sufficient.
Self-sufficient, okay.
Self-sufficient, and that's a whole bag. So we're missing so much opportunity with our other 39 governments that are here.
Okay.
I've already reached out to a few of the administration on that side. We're going to do business. Again, we're going to do business with Oklahoma. So whether that's with the native government or with the people that produce, we're going to get to a point where revenue is over the budget. And this is probably going to shock a few people, but I plan on giving that back to the people in the same mechanism as we get state runs. So that's why I'm saying is that they're going to want to make sure that budget is exactly where it's supposed to be, and we'll be able to do that because we'll have eyes on it. We'll be able to do it. But let's just say, for example, and I'll get off of that. Let's just say, example, we have an $8 billion budget, and we always have to take care of our just like we would in a home or in our house. Take care of our bills first.
Yes.
Take care of our obligations. Those are foremost. So say we produced $9 billion. Okay, so $8 billion went to and it can be even less. It could be $5 or $6 billion by the time we get through. So the state of Oklahoma, these are going to be state enterprises. No, I don't understand what they're doing with the farmers and the poultry. That's an opportunity there for money. That's an opportunity there for energy. We've spent $30 billion on litigation. We could have built 10 processing plants that provide energy for us. So again, back to, so we pay our bills. We've got $1 billion excess. That's not my money. That's not the government's money.
Right.
So
it's the people's money.
It's the people's money, and that's what they don't understand is that I don't.
So the oversight and the accountability will save from abuse and abuse and waste and fraud.
Correct. That's the first phase. The second phase is to get Oklahoma people a state check. Now, at the end of the year, same mechanism. We don't even have to work through any of that stuff. It's already there. But if Oklahoma does good, the people should do good too.
Okay.
So that's my way. Now, I can't control what Washington, D.C. does with federal taxes, income taxes. We are stuck there until they get that gone or whatever. But what I can do is if Oklahoma, those that contribute, of course, at least lessen that burden is kind of cushion, offset it a little bit. So if you owe $300 in tax, maybe you get, a $600 check for, and then there's your tax money. And that's the best way, looking at the system and how it works. That's the best way I can see that it's working. This is all not in bills. We're still going to have legislation. We're still going to have to go through that whole process. And there are good legislators that believe that, the same way that I do. So, yeah.
All right. What is the biggest thing that isn't working in healthcare for Oklahoma's families right now? What do you see as the biggest thing that isn't working in healthcare for Oklahoma families right now?
So, I pay $1,800 a month.
$1,800.
$1,800 for two people.
Okay.
That's my wife, or that's me and my wife. It is terrible insurance.
Okay. What company are you with?
Blue Cross.
Okay.
But it's it's state mandated.
Okay.
See, I can't even opt out of that. But we still pay copays.
Okay.
And not small copays. We pay $100, $200. Every time we see a doctor. If we have surgery, I had a nodule taken off my throat. I still had to end up paying, I think like $3 or $4 grand for that. I'm thankful they paid for the rest of it, but I don't know why we have insurance if they're not going to pay. But that's why I put Oklahoma first.
Okay.
I cannot abide by insurance companies, medical insurance companies, deciding whether a person should live or should die based on a policy.
Okay. Good point.
That you cannot, or left aside. We can't help you because you don't have the correct insurance. We have to care about people more than that. So I'm going to get real deep. The Oklahoma First healthcare plan. That's for us in Oklahoma. That is a state we're going to negotiate with these doctors. It's going to take a whole other team to do it. But as governor, I can make a whole other team if I want one.
Right.
So we're going to hit that. We're going to but we already have mechanisms in place. Medicare is there as well. They work on negotiated fees already.
Right.
We're just going to get a better deal for doing that. Our prescriptions are wild. My mother and father, they still, even though they're on Medicare, our plan A and B, they still pay a pretty good chunk for prescriptions. And I at some point we have to stop. These people worked their whole lives, doing things, working for a company, producing, being productive, and then once they get to a certain age, they're like, okay, well, we're still going to charge you for X.
Right.
And I same way with property stuff. I don't feel like that is. I don't feel like that's right. Actually, I don't. I think that the folks on Medicare, those should be at least heavily discounted, so that they can get the medications. And here's the other one problem, and then I'll get off of this. Is when you go into the doctor, and I have the VA. I love the VA, but I have private insurance as well. So when you go into the doctor and they say, okay, you need this surgery X, I guess it's their right. They can deny that surgery, based on, or you have to do a series of just painful tests to get to the point.
On the healthcare, so the premiums up too high. You got to have high deductibles.
Yep.
Surgery, they can deny. So with the Oklahoma healthcare, would you say that the whole system, since we're talking about systems and government, and the real animal, how things work, because a lot of times people don't understand that we're dealing with systems of operation going on.
Right.
Just like homeowners insurance, that's another big animal here in the state of Oklahoma. What are your plans to offset some of that cost on homeowners insurance, because it's out the roof for most people?
Yeah, and that adds to your payment. So you purchase a house and the payment's at $800. Like, okay, we can do that. And then your insurance ends up being $400, $500.
Right.
Then that just prices you out. Then you're up into the 1100s, 1500s. We are going to have. That's the exact reason why I asked for the meeting for the insurance commissioner. We're going to have to get really, really involved in how these companies. Because they're all regulated by the commissioner. I don't mean to call him out, but we need to understand why that's happening. Now, I don't have any access to their data, so I can't make an educated decision. When I can, I'll make an educated decision on how we're going to reduce that. But that's why the Oklahoma, what you just mentioned there, those are going to be reduced either by a person's income or a set rate for everybody, under $300 per family, that sort of thing. But yeah, we're gonna have to dig. There's really no other answer other than I need to see what policies or the underwriting on those policies and why they're able to do that. Because you hit on a very big nerve. Is that if I go to Tulsa and I try to get an insurance quote, and then I go to Lawton, Oklahoma, I'm going to get a different quote.
Right.
And that can't be it. That is, there's a word for that. I won't say it. So we need to stop that price gouging, those sort of things. I seen something very disheartening. When we were going through just this last little snowstorm that hit us. Everybody's out for water, toilet paper, and all that stuff, and they're marking those things up. We can't have that.
Right.
So we have a big grocery store here in Muskogee, and it replaced our mom and pop grocery stores. And I like big business when it's beneficial for everyone, for the people.
Okay.
Not just, as a revenue. There's tons and tons of way to make revenue, and we don't have to screw the people to do it.
Right.
They're just not. They're not thinking about all the things. And maybe that's my edge, because I can look at the whole picture. Not one other candidate can say, "Oh, I see the whole picture. I see how that's." Because if he does, I'm gonna put him in deer in headlights. Is what I'm gonna do, because I see them focusing on. And I'll sorry, I gotta let's say this, Tracy. If you're okay.
Go ahead and ask your question.
So a lot of them are focusing on the BA thing, on the mosque. I went to that mosque. I met those people.
Okay.
For me, there's nothing to worry about there. But City of Broken Arrow spoke and said, "Look, we don't want any more."
Okay.
There are.
You're talking about the Muslim mosques.
Yeah. There are there are 12 in Oklahoma City, or excuse me, sorry, there are 12 in Oklahoma. There's 6 in Oklahoma City. There's a few there in Tulsa, and obviously they were. They're there to worship in their way, and that's what the Constitution says, is a freedom of religion. But here's where things get. I don't know if I want to go into that. Islam is not compatible with us.
Okay.
On many reasons, Sharia law, the way that they treat people, what's actually in there. And I'm not trying to get religious. I just wanted to hit on it for just a second, so people know I'm thinking about it and I'm looking into it. But see, I don't take anybody's word for stuff. I go and see. I go and check out. When there's a problem, I go and see it. So, So that's what I was doing, is assessing. But they talk about Sharia, banning Sharia law. Sharia law has already been banned. It turns my stomach every time I hear another politician say, we're going to ban Sharia law. It's already been banned. 2010, we've already done this.
Okay.
So they're in fear. They want you to be scared. I'm going to tell you. They want you to be scared so that you vote that way. And that's not how you run an election. Okay. And that's not how it should be. If I had to scare somebody to vote for me, I don't want that vote. I don't want you to be scared.
Okay.
I want you to know exactly what I'm going to do. Because I think
vote on the merit.
Yeah. Everything exactly. It's like a mirror.
Okay. Is there a problem with providers or something else when we talk about healthcare? Is it a system problem? Provider problem?
Oh, it's a money problem.
Structure problem?
It's a money problem.
It's a money problem.
Can
you explain a little bit what you mean? It's a money problem.
I hope I can.
Because we keep seeing prices
yes.
go up. Make it
so
unaffordable for the common man to even have health insurance.
Yes, ma'am. That is. I've always felt it was a money problem. This is my opinion.
Okay.
I have to state my disclaimers as well. It's always been a money problem. The systems that are in place, because I did work for a healthcare company that provided all the state of Oklahoma their software. So I'm just as in depth in that realm as I am in the other systems. They have a system. Now their day-to-day operations, those systems that get there, what's the one you got to ask? You got to ask a pre-approval, whatever. That system's
pre-existing condition.
Yeah, and that has always been. But they're it takes weeks. Some doctors get them in like clockwork. Others take many times, and if you're sick, that's a problem. So that's the only one that I see on that side. But it is we should look into big pharma.
Big pharma.
Big pharma.
Big pharma.
That is a definite driver.
Okay.
Of what medical care that we get, and I only know this because I seen it with my own two eyes.
Okay.
So nobody can say, "Oh well, you don't." I've seen it. So these, and I won't explain, or I'll expand just a little bit. So the reps come in, push this drug. That's how we ended up in the opioid crisis.
Okay.
Now, no doctors, even if you're in pain, won't even prescribe any pain medication. They give you ibuprofen.
Do you think that we through pharmacy or through reps pushing a particular prescription got us through some of these dangerous zones, and now if you really get hurt, there's no medication that can be prescribed because they put you through management?
Well, look at what happened.
Okay.
All that stuff went to pain clinics.
Pain clinics.
Money. That's a for-profit clinic.
Okay.
So you tell what happened there. Now, even that you got the for-profit clinic and you're going to the doctor, you have to go through series of tests and series of things, to even get that medication. And then you have to go in, and they make you feel so bad about asking for medication about pain. So I'll tell you. So when I was in the Army, I got injured. I couldn't walk, for almost 2 years.
Okay.
After I got out of the military, and I couldn't get a job because PTSD was pretty rough. Thank God that's all over with. But when I was in pain, for the better part of 4 years, the VA prescribed medication, and then one December they said no more, and a lot of people they didn't know what to do.
Right.
And I'm gonna say another thing. The medical marijuana industry, or that medicine, I call it medicine.
Okay.
It's been medicine for, I don't know how long we've been alive, but it's been a medicine ever since that time. And I am so glad that when the state question came up, I helped as many petitions, as many signatures that I possibly can to pass that.
Okay.
Because our veterans need it, our folks, you know, that seems to be the only thing that helps them some of the time. But then we've got where it's a not a stigma, but a taboo type deal. But we need to look at more natural. I'm not saying natural.
What alternative?
Yeah, alternative things to be being used. We know medicine hurts. Have you looked at the side effects on your medicine?
Yeah.
I mean, it causes nausea, dry, all that other stuff.
Well, I can agree with you that it's a system. The system that you're talking about in city government. I mean, in state government, that everything is systematic. I do know. I can agree with you that if you go to the doctor, you can be. It started to overturn where he has you coming back every 3 months. If there's something, never do they get to the root cause of your problem. They only address the symptoms by way of a pill.
Yep.
And the pill becomes something that you take indefinitely, you know, like it's no cure for whatever that may be. So I can understand when you say what you say about that. But as you saw where Governor Stitt just came out and wanted to put it on the ballot to rescind the voters' vote on medical marijuana. What's your thoughts on that?
56% of us said we want it.
Yes.
If a governor will not listen to his people, he probably shouldn't be governor.
Okay.
And my ears are open. And I have no idea what's wrong with that guy.
So let me ask you this: while we're talking about the systems, medical marijuana became a new revenue for the state of Oklahoma. Right. Do you happen to know what that number is? Because I can never get a true number of how much revenue medical marijuana has brought in since the time of inception.
So when the state question come out, I did an analysis on that. And then I worked for the state, or I work in the state, public servant. I have to say, you're probably not going to get a number because we don't know. They don't know. They don't have. When I talk about tracking and when I talk about oversight, in the 25 years, I've never seen oversight on any of this stuff. Not definitely through the payment system, definitely not through a public portal or form. They do publish data, and here's something that I'm going to build for Oklahoma, just so they know this is how the transparency will work. So I built, did I already talk about the Epstein files?
No.
Okay, so I built a TAP platform just for that, as a proof of concept of this is how, you know, that's 3 million records. That's a lot of records. So now I have those all in my database, everything that they've published, and then people are going to be able to search to it, and so on and so forth, so they can find out for themselves instead of listening to media or listening to, you know, whoever says whatever. They can find out for themselves, and that's really what I encourage. So what I'm going to do is I'm going to build a data set system before the election opens up, and there'll be a couple other ones about 3 weeks before the election actually happens. I can't mention anything because I don't want any roadblocks. The state of Oklahoma has data sets, and what you're supposed to do is go through those data sets and sift through them. But if you're not an IT guy or a software programmer, you might as well they didn't give you anything, because that system is a very, even for me, being 25 years in tech, it's pretty tough to get navigate. It did start out as a cash business. I think that some of those, it goes back to where's the casino money, where's the TCS money, where's the medical marijuana money, where's there was a fourth one, that was supposed to fund schools as well. So we're going to make sure, or at least I'm going to make sure, that our funding, that way we can remove property taxes from the books. I don't think that's right. If you've paid for I'm not paying for my property 3 or 4 times every year.
But that's a good injunction. Let me ask you that. So one of them say, if you remove property tax, where do the other entities get their money from?
Yeah. Well, we're supposed to get it from the casino. We're supposed to get it from T-Set. We're supposed to get it from the other 4 ends. How about the turnpike? Where's that revenue going? It's not going to our roads. Our roads suck.
Okay.
You know what I mean? I mean, this is the problem. Is there's no oversight on these deals that are supposed to fund these things.
Okay.
But I can guarantee you that when I'm done, we're not going to need the property taxes. Cities, councils, they have federal funding as well. I don't want to depend on federal funding. Right. I want us to be self-sufficient. I want us to be able to stand on our own 2 feet and say, well, we've got the state management where we employ 2,000 people. We've got our own health care that we, that works for us. We negotiate all these. I want Oklahoma to be out of that race and be the example. And us being 50th in education, I am more hard on education. We're going to see some changes there.
How do you think that we can move up the ladder in education? What is your plan to get us out of the 50th spot?
We're going to teach the kids the way they learn.
Okay.
Right now, because the way we learned back then, it's not the way they learn now. Back to basics.
Back to the basics.
Back to basics. We're going to learn how to do math.
Mm-hmm.
We're going to learn how to read.
Add, subtract, multiply, divide.
Yes, ma'am. There you go. So we're going to go back to basics. We're going to get rid of everything else that's not that. In addition to that, and I know everybody's kind of quenched up one, but in addition to that, we're going to give families, homeschoolers, the opportunity to take courses they want to take courses.
Okay.
It's family. The family has to sign off on it. Let's say, for instance, your son wants to learn about music production.
Sorry about that. I'll be over there.
Yep, I'll be done.
Go ahead.
Music production. He'll have a class that he can do. It's an elective that he can learn about, and then we're going to give the tools. We're going to give the tools to the parents.
Right.
So when a child comes home and says, "Hey, I don't know how to do this," I don't. We're going to give them the tools, the parents the tools to say, "Okay, this is how we do it," and be able to be that authority figure in the home that they come to for answers.
Okay.
We are so choice for the parents. Mm-hmm. Whether you're a state school, whether you're a private school, charter school, whatever. So we're going to give them choices. We're going to give the teacher. So I don't understand how this hasn't happened before. So I have a draft of how this might work. It's not all written in stone just yet because the legislators got to approve some of these things. So I have to talk with them, and I talked with one. I've got a few more that I've got to meet. But in my mind, COLAs every year. So you have what's an average teacher make? Do you know?
Not for sure. I would think that the first year teacher come in making anywhere 36 to 40,000 a year.
Yeah. 36 to 45. So
45. Yeah. Okay.
So what I want to do is I want to start the new teachers. We're going to have to do something with the teachers to help them educate these kids.
One lady say strategy is a great point.
No. We're going to give them COLAs every year until they reach 65K, and then we're going to give them a cost of living adjustment. They need it, and then all state employees really need that. So we're going to look at that system as well. Again, that's just a draft, but I plan on everybody that's a state employee for them to at least get that COLA every year until we reach our max.
Right.
And then that's the way that we level off You know, and then as people retire out of the system, it revolves. You know, put 20 years, 25 years in a system. So we're going to give them more money, and we're going to give them. This is new. Again, I'm an AI guy. I've been there since day one. Even before AI, I built much like the system, but they've got a whole lot more money in quantum computers. We're gonna so bus drivers. I didn't realize that was such a big thing. That's just a part-time gig for them. So I want to bring in some training for those to be de-escalation training and obviously their own traffic. But I want to make the bus drivers also school security as well. So it's a full-time gig, because when they hire out, they're paying almost 2 to 3 times the cost as if they just had a full-time guy, full-time, or 2 or 3 full-time bus drivers. They'll double back. Great job for veterans. You know, the veterans are going to know. That's why I want to protect the kids on the school grounds. So it's going to be very veteran heavy, because I don't know of a single veteran that won't protect your children. I don't. We're gonna do what we have to do to protect that child, and this brings on to a very hard something that I just absolutely cannot believe that's happening to our children. Every time I turn around, something's happening to our children, and we just cannot let that happen.
Right. Well, you see where they come out and they want to revamp DHS.
Yep.
Come up with a new program for our children. Also, you saw where it came out where the report shows that the state is top heavy as far as, and then the bottom state workers don't get any increase in the state. You know, I mean,
100%.
One of the positions that were the Governor Stitt appointed, or someone, he went to make it from $120,000 to $300,000, but nobody in his department had any increase at all. That is a bonuses. Common, they got bonuses. That's a common practice that we see, not at the state level, but also at the local level, whereas top administration is heavy, but the common man that works is down at $10, $12, $13 an hour, and they're not necessarily an employee of, they work through a temp, and the temp get a nice piece of that hourly wage, and the worker, I mean the one that put in the work, that picks up our trash, or that work out in the field, they're not making very much money at all. So those are good things that we'd like to see you do. I'm gonna read a couple more questions before we wrap this segment up. I want to thank everybody for watching tonight. Once again, I just want to let everybody know this is Billy J. Wagner. He is running for governor of the state of Oklahoma. What does Oklahoma First healthcare actually mean?
It means that we put the people first. We're not concerned about the profits. We're not going to kill people over a piece of paper or deny a claim. We have to care about people more than this, more than a piece of paper, more than a dollar amount. God put us here, and I'm sure it wasn't to fight the insurance companies, and I witnessed this. I saw it firsthand with my father-in-law, who is probably the last cowboy I know or knew. When COVID hit, we weren't able to see him. There was no updates on his care, and they just let him die. And that's what really sparked a little bit of this, is that we do need a definitive plan which again, Oklahoma First is a draft, and we're getting it, but you can read about it. And I'm going to listen to the Oklahoma people about where we should go. I know what we need to do to stop the bleeding, but moving forward past that, what kind of healthcare is good healthcare? Is it a lower deductible? Is it lower cost? For us that need it, that's a pretty big deal. And then providing the care. I want good doctors again. I want doctors that be like, hey, you need to stop doing that.
Right.
But Ms. Traci, you make 100% great point with the fact that they don't ever get to the root of the problem.
Right.
And I think that us here in Oklahoma, again, setting the example is that we have a great cancer institute here in Tulsa. We were looking at, I can't remember what that medicine's called, but it helps with the T cells because if your T cells are healthy, that's your warriors. That's the ones that make your body a whole lot better. And as technology improves, and AI even in that matter, in early detection, I was part of a program that was about 9 years ago when AI was still, still in its infancy stages. That we analyzed blood, and then it could tell you at early warning stages. So we need more innovation that way. I want doctors that want to push for the cure, not to get them back in, every Friday or every 6 months or every 2 months. I do understand that's, but we need to pay. We need to pay different,
right,
on that side, but.
Okay. Well,
means us first.
Mean the people first. Okay. Yep. How do you control healthcare costs without cutting care?
Well, again, we already negotiate. We already have a system in place that we negotiate. We will just negotiate a better deal for our people on that.
Okay. Our final question for tonight. Mm-hmm. If this works, what change for families? Healthcare become predictable, fewer surprises, lower stress. Mm-hmm. What changes?
People will be able to see where their state is at. For one, transparency. Two, they're going to have tools to help their family succeed. Three, businesses are top priority on my list. I want the mom and shop pops, or mom and however you say that. Yes, ma'am. We all want those back. Those were real genuine. They didn't want. Oh, I forgot to mention. Also, the food. The food is a very big part of what we're going to do as well. So we have producers here in Oklahoma. We produce a lot of things. So when I say Oklahoma is open for business, we are going to produce. And if other states need it, okay, then we make revenue there. But I don't want GMOs. I don't want pesticides. I want naturally grown food for our people.
Okay.
That way that it gets to be a habit. See, it's a habit to go down to McDonald's. It's a habit to go to Burger King because it's convenience. It's a habit to cook at home. So if we start eating better, and start eating our own food, our locally grown food, that we can at least trust the farmer. Chickens, good Lord. This is what's going to get me here. So you know how Tyson, I'm trying to, we all know Tyson's here in Oklahoma. That's public information. I don't think they understand, you ready for it? I don't think that they understand that we have enough money to make a state business for our local farmers. I don't know why, other than Tyson is paying, I don't know this for a fact, and I don't want anybody quoting me on that because I don't know their numbers, but I don't understand why we're not doing local business with the chicken farmers. Okay. That poultry waste, that's energy.
Right.
That poultry waste, that's polluting, that they're just dumping.
Right.
And just got a slap on, this is my opinion, got a slap on the hand. That's money. That is money for us. And that can fund other things. That can fund processing houses. That can get us out of litigation for the next 20 or 30 years. We spent $40 billion on this. And we could have done this 3 times over.
Right.
And nobody's talking about it. But anyways, okay. So they're going to be a lot more stable in what Oklahoma does. Now, again, federal government is the federal government. They're going to do what they're going to do, and we are the state. We can do executive orders. We can do those things to get things jump started. But ultimately, I hate to say that, there's the only people I have to ask permission from. Other than that, I'm not asking people for permission for what I'm going to do when I'm in office. We're gonna take it. We're gonna do what we need to do, because I think, in fact, I know, because I hear it all the time. I think we're tired of just getting pushed around. And when 50% of my check comes out, and I have no clue where it goes to, I'm not supporting Hamas. I'm not supporting some other place other than Oklahoma. We are going to keep our money here in Oklahoma, and we can do that as long as we are self-sufficient. And that's my main goal, is self-sufficient and education. Yeah, I like that.
Well, there you have it tonight, guys. We have Billy J. Wagner, of Pryor, Oklahoma, lives now here in Muskogee, Oklahoma. He's running to be the governor of the state of Oklahoma. I want to thank everybody there for watching, and thank Billy for stopping by Tell the Truth Tuesday this evening.
Yep. And my messenger works all the time.
He said you can reach him by messenger as well, but his website is Billy J. Wagner. For more information on him, billyjwagner.com. Well, there you have it. We had a special guest tonight. We want to thank him for stopping by.